Hello everyone, my name is Kristen and welcome to my YouTube channel. I am a newborn nurse, otherwise known as a nursery nurse or a transition nursery nurse. And I always get the question on what is my job description? Is it like working in NICU? How is it different? Is it similar to postpartum nursing? So I thought I would go ahead and sit down with y'all and talk you through what a typical day in my life looks like whenever I am on the job, so you can get an idea of what I do as a transition nursery nurse or a newborn nurse. Maybe this is something you'll be interested in, or maybe I'll introduce you to a whole new part of nursing that you did not know existed. So if you're interested, just go ahead and keep watching. So just a little background information before we start going into what a typical day looks like. I do work on the labor and delivery unit, but I am not a labor and delivery nurse. I am a transition nursery nurse. I specifically work with the healthy newborn babies. Really what that looks like, you have the labor and delivery nurse that takes care of mama throughout the whole entire labor and delivery process. And then you have me that takes care of the newborn right when the baby comes out. I am a day shift nurse. I recently just switched about 2 months ago from night shift to day shift. So I am going to be talking all about in future videos how I got through night shift nursing, what my routine was like. So don't worry, I have been asked tons of questions of how I made it through night shift. I will be getting those answers to you soon. I do work days. I work 3 12-hour shifts, and with that means I work 3 days a week and I have 4 days off. It's nice to have that type of schedule. I have flexibility. So the way I'm gonna lay out this video is kind of show you different video clips throughout the day, just so it's not a sit down video completely, because I want you to see what I do in a typical day. Hopefully y'all like this style of video, so at least you can kind of visualize how my day goes. I normally wake up around 5:30 in the morning, and pretty much all I do is I get up, I wash my face, I brush my teeth, I change my clothes, I make a very quick breakfast. Most of my breakfast consists of smoothies, bagels, breakfast bars, and just small things like that. Or if I'm able to prepare the night before, like oatmeal. When I leave and I am driving to work, I like to use this time to just have a little bit of peace and quiet. So sometimes I'll put on soft music, I'll put on a podcast, something that's motivating, something that's gonna give me good energy to start my day off right. When I get to work, normally I'm clocking in by like 6:45, 6:50, and then I go and change. I go to the scrub machine, take out my OR scrubs. This is very important because we are sometimes having to go back to C-sections, and in the OR we do have to wear hospital scrubs, so I'm always changing into different scrubs whenever I'm at work. Once I get all changed and ready to go, I take out my Vocera, pens, I make sure I always have a cord clamp, and then I go get report if there is a baby for me to pick up, and just wait around until the moment I am called for a delivery. So when it's time for newborn to come in the room, what does that look like? Well, when mamas are 10 centimeters dilated, and they are 100% effaced, and baby is in a positive station, that means that baby could be crowning soon, or they've seen the head, something along those lines. The provider knows that it's time to call newborn. I will get a call over my Vocera. It will just say newborn 2. It will either be the room number that I'm going to if the mom is delivering vaginally, or if for some reason it's an OR case, then I will go to whatever OR they call. So there are multiple newborn nurses working and we rotate. So if it's my turn, what I do is I go grab some towels, because sometimes the rooms do not have towels. And if you've never seen a birth before, there's lots of fluid and liquids, and I always bring extra towels. I run to the room, I get my warmer all set up. I make sure that I have an ambu bag ready. I have all my oxygen set up just in case the baby needs to leave for some reason to the NICU on CPAP. I also have suction ready. I make sure that I have a pulse ox nearby. I make sure I have a hat, a diaper, a bulb suction, and then I always ask to see if they have a cord clamp ready. And the last item that I have ready to go is my stethoscope. The warmers are always in the back of the room, and I'm pretty much just waiting at that point just for when the baby comes out. I'm listening to the baby's heartbeat, making sure that the heart is within normal range. I'm also waiting for the head to come out as well. Once the head comes out, I hit my APGAR timer on the warmer, and I'm waiting for the shoulders to be delivered. Babies can get stuck coming out of a vaginal delivery. And so it's so important for me to always remember to hit my APGAR timer whenever the head is out. But once the baby is delivered, I go ahead, hit my APGAR timer again. That will restart my 1-minute APGAR for me, and I go over and I catch the baby. So I am, yes, the baby catcher. The moment that the provider puts the baby on just the mama's stomach area, I'm taking my towels, I'm drying, I'm warming the baby up, I'm stimulating the baby, making sure that the baby's crying. I'm looking at the baby's tone, I'm looking at the baby's color, I'm looking to see if the baby is breathing, and I'm also seeing if the baby is grimacing. And I can always get a pulse from the umbilical cord to just make sure that the baby's heart rate is above 100. So I just gave you a quick rundown of all the categories that I go through whenever I am looking for my 1-minute APGAR and my 5-minute APGAR. So these scorings are important, and I always make sure to tell the provider before I leave the room what the APGAR score was, just so the providers are aware. Of course, the next thing we have to do is put the cord clamp on, cut the cord so the baby is no longer attached to mom. At my hospital, we do like to do delayed cord clamping if it is appropriate, where basically we wait 30 seconds before we cut the cord. If the baby's okay, we stay skin to skin. I put the baby right on mama's chest. They stay like that for 1 hour. If the baby's not okay, I'll take the baby to the warmer, and then from there we kind of assess what else needs to be done. Within the first 10 minutes, I make sure to get my first set of vital signs. This includes respiratory rate, heart rate, and temperature. And I put a hat on baby, I put a diaper on baby. I also make sure to give baby a new warm towel just so the baby doesn't get cold. Before I leave the room, I know it's not always possible to do it this way, but I make sure to get the baby banded as well as the parents. Once the baby's out, the mom will stay on labor and delivery for about 2 hours, and that 2-hour mark actually starts from the moment the placenta is out. It is a very quick turnaround time that I have to get everything done. After that, I go back to my desk and I will go admit the baby. So on my end, this is a fresh newborn, so I do have to go through the admission process when it comes to admitting the baby, and I chart whatever I need to as well. I also make sure to print out the baby band. Then I also get my labels that I need, grab my meds at this time, which is vitamin K and erythromycin. So those are the 2 medications that we give to all of our babies. Then I will grab my Cerviscan, which is our electronic footprint scanner, and I will also grab 2 blankets and then a white t-shirt just in case the parents don't have clothes for the baby. So once I get all my stuff together, I go back into the room. Normally, this is around the 30-minute mark where it's time for my second set of vital signs. I get my vital signs, I ask the parents if they're okay with the medications, and if they are, I get them scanned and I get them ready to give to the baby. This is a point in time where I do try to get the baby breastfeeding as well, because giving the vitamin K injection while the baby is breastfeeding tends to keep them very calm and they don't cry. So if the parents decide they don't want to breastfeed and we're only formula feeding or we're pumping or something like that, so I'll just go ahead and do what I need to do when it comes to my medications and my vital signs, and then I will go ahead and get the formula ready and get the baby sitting up and ready to go for feeding. And of course, throughout everything I'm doing, I'm always educating the parents, especially when it comes to breastfeeding, formula feeding, the medications, back to sleep, safe sleep, temperature control, all that stuff. Now that the baby is all taken care of whenever it comes to the meds, my second set of vitals, and feeding, I leave the room and then I come back in 30 more minutes. It's time for my third set of vital signs. I'll get the warmer all set up, take baby to the warmer. I do all the fun stuff. I do the weight, I'll do the measurements, the length. I'll also do a head circumference. I will do a chest circumference and then an abdominal circumference. I'll make sure to do the footprints, and then I do a very thorough head to toe assessment. This is the first time baby's ever been looked at. I go through everything because I don't want to miss something if something's going on with the baby that maybe they didn't see on any ultrasounds when baby was in the womb. Don't worry, I will be doing a whole newborn assessment video specifically related to what I do at my job, so y'all get an idea of what that newborn assessment looks like. Another thing I might do at the warmer after I get the footprints done is a blood sugar. Now, the reason that I would do this is if the baby is small for gestational age, so less than 2,500 grams, large for gestational age, which is above 4,000 grams, or if the mama has diabetes herself, whether or not it's type 1 diabetes, type 2 diabetes, or gestational diabetes. On a normal day-to-day basis, I usually do not do labs, but in case I do have to do a lab test, I will also do a lab test around this time as well, whenever the baby is at the warmer. Really, by the time I'm done with all of that, 20 to 25 minutes have gone by, so then I get my 4th set of vital signs. I go back to my desk, I print out the certificate that has the footprints on it, and then I finish charting anything I need to when it comes to the assessment. And I go back into the room one more time to get my 5th set of vitals. And as you can see, the trend is get vital signs every 30 minutes. I go ahead, I give the parents the certificate, and I finish any education. One of the most important things that I do like to reiterate is making sure that they know how to use that blue bulb suction. It's very important in case they need to clear out baby's airway. Now, once I've gone into the room for the last time, I'm pretty much done. I'm ready to use my report sheet and call report. When I call report, those babies do go with mama to postpartum. We do like to make sure that these babies are rooming in at all times with mom, and we don't separate them unless it's absolutely medically necessary. A majority of these patients that I work with, I only work with them for about 2 hours at a time. It really does feel like a clinic job where we're basically getting them in and we're getting them out to postpartum. Days can definitely be busy, so I do really try to make sure I take a lunch break sometime in between there. Things that I like to bring for lunch are salads and lighter things, just because I am running around the whole entire day, and I do bring really good snacks like fruit. Now, on a typical day, I normally get about 3 babies on average. Yes, 3 babies throughout the whole entire shift. But don't forget, I am taking care of babies for a 2 to 3 hour period at one time. That does take up a huge chunk of my day whenever a baby is delivered. On a slower day, I might have 1 to 2 babies, and on a really busy day, I could have 5, 6 babies. It really just depends. And whenever I do have 2 babies at once or 3 babies at once, it does tend to be a little bit more hectic because I do have a lot to do within the first 2 hours of that baby's life. So I am really having to make sure I'm time managing properly and getting things done that need to get done. If moms are staying on the unit to be observed for a longer period of time, this could be mamas that have been given magnesium for preeclampsia or eclamptic episodes, and a mom that has hemorrhage. Those mamas will stay a little bit longer too. So we do have to follow these babies longer than the 2 hour mark. If I have a baby that's staying for my full 12-hour shift, I will make sure that the baby has a feeding schedule. We like to do every 2 to 4 hours, depending on if the baby's breastfeeding, formula feeding, or if the baby needs to have their blood sugar checked. Another thing I'll do, especially with a MAG baby or a baby that is staying on the unit, I'll also do the hepatitis B vaccination. This is the first of the series. If the baby stays on our unit for 24 hours, then I do have to do the newborn screening. So this is where I just get 5 drops of blood from the baby's heel, and I go ahead and I put it on a card. We send that card off to the state, and then the state evaluates to see if baby's at risk for 30 different health conditions. I will also do a pre and postductal O2 saturation as well. Now, whenever I do get to the end of my day, I do go ahead and I change and I make sure I grab my lunchbox and my backpack, and then I head home. After a long day, I really do like to make sure that I come home de-stressed, because work can sometimes be stressful, even though I work with those healthy babies. I really hope this video gives you a good idea of what a typical day looks like, and to just try to describe what my job description is. I've gotten so many questions. Lately, people have been reaching out to me saying that nursery for them is a dream job, and I'm so glad to hear that people are interested in my type of nursing. Sometimes I feel like I don't do much, but at the same time, I do love the job, and it's just a more happier setting. Although I do from time to time work with fetal demises or babies that have passed away after birth, for the most part, my job tends to be more upbeat, and I do appreciate the fact that I can go into work and just see these parents so excited to see their fresh newborn baby. Well, I hope you enjoyed today's video and it gave you a little bit more clarity on what my job is. Feel free to put any comments, suggestions down in the comment section down below, and you know I always just want to wish you luck on your nursing journey.